Okay, wonderful. So hello everyone, and welcome to our webinar highlighting the National Collaborating Center for Healthy Public Policy's online course, An Introduction to Public Health Ethics. My name is Kristen Reed, and I am a research coordinator at the National Collaborating Center for Methods and Tools, and I will be helping to facilitate today's webinar. So thank you for joining us today, and I hope the platform change to Zoom was not too inconvenient. So I do sincerely apologize for any confusion that may have caused. So at this point, I would just really like to take a thoughtful moment to recognize that here at the National Collaborating Center for Methods and Tools, we are situated on the traditional territories of the Mississauga and Haudenosaunee nations, which are acknowledged in the Dish with One Spoon wampum belt. And this wampum uses the symbolism of a dish to represent this beautiful territory, and one spoon to represent that the people are to share the resources of the land and only take what they need. So as we all move forward with our busy and intertwined work and personal lives, I hope everyone has a chance today to spend a moment and reflect on these teachings and both their historical and current relevance and value. Thank you. So regarding the format of our webinar today, our goal is really to provide a brief overview of the course, including its development and content, and to consider how an ethical perspective can inform public health decision-making. This will be presented by Michael, who I will introduce shortly. We are also very fortunate to have two colleagues joining us, Laurel and Haley, that will be speaking to their experiences of taking the course, as well as some of the ethical challenges that they've encountered in their own work. Then we will open it up to questions for the presenters and hopefully also have a chance to have a bit of a larger discussion and reflection on ethical questions and considerations that have come up in your own work. So a few housekeeping items before we begin. There are several ways that you can engage with us in this webinar today. So we do very much encourage you to use the chat box to tell us about yourself and share any of your comments or thoughts throughout the webinar. We also have the Q&A open for questions to the presenters. So please add your questions here as they come to mind, and we'll try to get to as many as possible at the end of the presentations. And we will be having a few short polling questions at the beginning of the webinar to learn a bit more about who's joining us today, so stay tuned for that. Also, just to let you know that this webinar is being recorded, and you will be able to access the recordings after the webinar on the NCCHPP website and the NCCMT YouTube channel. So you can check out our Twitter accounts for updates on when those will be available at NCCMT and at NCCHPP. So our first polling question today is really just getting a sense of how many people are watching the session with you today. I know that often during this pandemic, it's likely just one and we are solo, but just to get a sense of how many people are joining us today. So we will leave this up for a little bit and then be able to share the results with attendees. While we are doing that, I would just like to give a little bit of a background about your hosts for the webinar today. So this webinar is brought to you from the NCCHPP and NCCMT. We are part of 6 national collaborating centers for public health. And for those of you who are unfamiliar, the NCCs are funded by the Public Health Agency of Canada and each hosted in different academic and non-academic institutions across the country. Part of why we as NCCs exist in the KT field is to reduce duplication, share learnings across jurisdictions, and help identify gaps in knowledge and practice, some of which I hope that we can get into today. So as you can see here, each National Collaborating Center works in a different domain of public health, and these include Indigenous health, environmental health, infectious diseases, determinants of health, healthy public policy, and methods and tools for evidence-informed decision-making. So just before I pass it over to our presenters, we would really like to hear from you. So how would you describe your level of knowledge regarding public health ethics? And where does this knowledge come from? So is it from formal sources or research, practical on-the-ground experience, or maybe a bit of a mixture of both? So thank you for answering our polling questions. It looks like that most people are joining alone today on your computers. So welcome and hello from your homes and work. And it looks like most people have, I guess, a bit of a intermediate level of knowledge. So I think there's lots of things that we can discuss today and lots to still learn. So with that, I will now pass the mic over to Michael Keeling in Montreal to start us off and to introduce Laurel and Haley. Michael is a scientific advisor at the National Collaborating Center for Healthy Public Policy, where he focuses his time on projects in two very important areas of public health ethics and climate change. Bienvenue, hello, Michael, and thank you for joining us today. If you want to turn on your camera.
Thanks very much, Kristen. And I see we've got about a little over 100 people in various places around. So thanks so much for joining us. Very much appreciated. Thanks for taking an hour to spend some time with us. Also special thanks to our other two presenters. Very much appreciated you took time out from work today to join us here. So thanks. Let's go to the next slide, Kristen, please. At the NCCHPP, we acknowledge that we are on an age-old Indigenous territory, a place of meeting and diplomacy between peoples, and the site of the signing of the Great Peace Treaty. We thank the Kanien'kehá:ka Nation for their hospitality on this unceded territory. And we can go to the next slide, please. All right, just to get started and to get us thinking in an ethical or thinking about ethics a little bit, it's always good to start with a case just to get things moving. This one is from an article that was published. It was a blog article published in May of 2020. So as the first wave of COVID was unfolding, and there was a lot of discussion about triage protocols, and people were starting to realize some of the inequities that were emerging around those most affected by COVID and so forth. So I'll just read this out. And as I do so, please think about whether there are ethical issues contained in this little story, and just give some reflection to what emerges for you as being important, okay? I'll just read it out though. Patient A is a 55-year-old African-American woman, COVID positive, and history of uncontrolled diabetes. Patient B is a 60-year-old white man, COVID positive, and no comorbidities. Both need the one ventilator available. The triage team reviews medical facts only and scores accordingly. Patient B scores better and receives vent. Review reveals that 5 of the last 6 ventilator decisions have gone to white patients over African American patients. Inequities noted. So I'm going to do a webinar faux pas, and I'm going to ask you just to take a moment quietly to reread this and to reflect on it, and we'll have a moment of uncomfortable silence. And I want you to think about the ethical issues that arise here and what's important. And when you've thought for a minute, then maybe you could start writing down your thoughts in the chat box, and we'll just see what comes up. Okay, let's take a moment. Okay. Maybe those of you who've come up with some things, maybe it's time to start writing. Let's see if people have thoughts about what, if any, ethical issues arise from this situation. I see keywords: age being considered, health inequities, systemic racism. Epistemic racism. A question about who actually was responsible for producing the scoring criteria. Racism, sexism. Someone questioning what are the medical facts? How were they arrived at and by whom? Who? Social and health inequities, SDOH, scoring criteria, scoring process, medical facts only. Yes, this article is from the States. If there are scoring criteria, it should be objective and race not a factor. Claim of implicit bias. What is the underlying cause of the comorbidities? Inequitable access to healthcare, inequities in our economic system, systemic racism, rationing, a question of whether it varies between hospitals. Uncontrolled diabetes could be due to social inequities. Linking chronic conditions to social determinants. List goes on indeed. Yeah, I think folks are making really good points there. And I prepared some notes and did some thinking about this. I had time to think about it as well. This is amazing for 1 or 2 minutes of reflecting on this. And there are definitely different levels at which we can look at this thing. I see a fair bit of fairly perceptive critical attention to some of the issues, like what are the medical facts and what else is relevant when you analyze a case like this? Is the history of comorbidities relevant to making a decision when there's a triage protocol? These are the kinds of questions that can and probably should arise when we look at stories like this. Another way we can look at this also is we can always ask, how did we end up in this dilemma in the first place? If you'll recall, in the springtime, there was so much talk about flattening the curve in order to ensure that we didn't arrive at this critical point where triage decisions were necessary. So seeing as we, in this case at least, they have arrived at that, it doesn't mean that we stop looking at how to avoid this happening again. And so taking another kind of critical look at the situation and saying, why did we have this situation in the first place? Another level still, we can look beyond this and consider, in the context of the US, for example, there are so many resources and it's stretched to the limits in the US. And then look from a global perspective, and we could ask, the US has so much access to ventilators and other resources compared to what's available for people in lower income countries. We have a global pandemic. And so to take that even more kind of global approach and ask questions there as well. I see embedded bias in scoring systems, upstream and downstream healthcare. These are great comments. Thank you all. This is basically to just get us rolling, but one thing that comes up from this kind of a story, the greater the surge of patients needing critical care and the greater the urgency, the more pressure there will be placed upon issues around equity. On the one hand, there are inequitable situations that, in a non-random way, bring certain populations more in contact and therefore more likely to get COVID. and also more susceptible to COVID due to other comorbidities caused by SDOH. So there's a certain triage process that's already gone on before you get to this situation. And now here's a further triage situation. But the greater the surge and the greater the urgency, the more that equity will be under pressure from a sort of maximize the lives saved sort of perspective. And those are two values that are both very important, but how we hold them in balance and how we decide how to deal with those are straight up ethical issues that deserve our attention. So can I have the next slide, please? I hope that sort of speaks to why public health ethics is important. No matter what program, policy, it doesn't have to be an emergency situation. There are decisions made that can affect the well-being of others. And this slide sort of speaks to one way that we envision at my center, the way in which public health ethics is important and can fit into decision-making scenarios. Just as we want to have evidence-informed decision-making, and NCCMT does a great job of making resources available on that side of things, there's a way in which we can look at the various factors that influence decision-making, not only influencing, but framing, motivating, informing, and justifying our responses to what we perceive to be problems. Ethical thinking can be something that also informs decision-making. And so bringing in an ethical dimension into decision-making processes can be very helpful in terms of reducing the harms that can be done through programs, policies, etc. And it can help to be more systematic and rigorous about making sure that issues like equity and other values that we hold to be important in terms of protecting people, in terms of respecting their well-being, we can get those things into play in a professional context. So that was some of the rationale for why my center is focusing on this, because we want ethical thinking to inform decision making as well. Some of the other factors, it's interesting too. This is a non-exhaustive list, of course, but some of the things that actually influence me may not even explicitly acknowledge that they're at work, but we're always thinking in terms of feasibility. How are things done in our organization and what's the mandate? Is it cost effective? What is the regulatory environment, institutional norms, etc.? Additions to this list welcome. Of course, this isn't everything that influences decision makings. Okay, can we move to the next slide, please? This online course, it's been a long time in the making. The last year or two have been pretty intensive, but we started thinking about this probably more than 5 years ago. And some of the partnerships that emerged along the way I thought were really interesting, and some of them were just by chance. But for a couple of years, 2016 to about 2018, we met and then got working with a research team studying bioethics and public health ethics at the Université de Montréal. And when we got to know them, we learned that they'd been doing a literature review on teaching and learning public health ethics. And they did a scan of what was going on at schools of public health around the world. And so we partnered with them for a while and developed a couple of surveys to see what was going on in Canada. This is in 2017, we did the surveys. And then we published the results, I think, early in 2018. We did one with schools of public health in Canada and another with health professionals or public health professionals. We had about, I think, 550 respondents, 450 respondents in all. And we published 2 short summaries with what we learned. That helped to inform our decision to go ahead and eventually develop a course, but it also helped to guide some of our choices in terms of other resources that we've developed in public health ethics since then. So that was a really fruitful relationship we had with the gang at the Université de Montréal. And then another chance meeting that led to a partnership was with the University of Waterloo School of Public Health and Health Systems. and their learning center, their Center for Extended Learning. We ended up working with them to develop an early version of the online course. And we then tested that course material, both the online course and just the basic material in person, with 3 different years of Masters of Public Health cohorts. We're still working with them, and I usually do a webinar or something with them every year, and they're still using this version of the course. So that was a great way to, one, get the course moving, and also to check in on whether the material was relevant, whether it was being appropriately presented, and so forth. And then in 2018-19, we sent it out for peer review with 11 or 12 medical officers of health, health professionals, experts in ethics, experts in public health, academics, and so forth. And we took in all their comments and tried to improve upon the material with that. And a few of those same folks who commented on it, we actually asked them if they'd be willing to record video interviews so that we could fill in some gaps in the material with their perspectives. And those videos, I'm really pleased with how those turned out. We ended up with 19 little video clips that are part of the course. And they're from 8 different people from across the country. Very different perspectives, and a lot of material that we wouldn't have been able to produce ourselves. So they really added to it. Then in 2019, we went on the road and tested this material with 3 different Ontario public health units. One was by webinar, 2 in person. And this was done in partnership with Public Health Training for Equitable Systems Change program. Recently wrapped up, that was through Dalalana School of Public Health in Toronto, at U of T, sorry. That gave us a chance to test the material with professionals, and also our thanks to PHESC, because they helped us to fund the course that was ultimately put online. And I mentioned the video clips. And finally, we published the course in English and French in October of 2020. So it's now online, it's available. And I'm happy to say that I think about 2,000 people have signed up for the course at this point. Haven't yet consulted evaluation material, but a couple thousand signed up. So that's really good news for us. Can I have the next slide, please, Kristen? Right, very briefly, the learning objectives that we had in mind with this. We want the course to help people to do 5 things in particular. One is to see and understand what public health ethics is. One is to apply ethics concepts, values, principles, and frameworks in practice. To identify ethical issues that arise in practice. To be able to deliberate and have ethical considerations inform decision-making. And finally, to have access to more resources, because this course, it'll give you a start, but you need to be able to find other resources along the way. Okay, for the next slide, please. The course itself has 6 modules, and we estimate that it would take about 5 hours to go through it. In the first module, we sort of do what we did today, introduce a case to get you thinking and reflecting on ethical issues. And in that module, we also talk about what's the difference, how do things differ if you take a descriptive stance versus a normative stance, and we relate that to public health ethics. And then we discuss the importance of bringing an ethical perspective into your work. In module 2, we look at some of the main features that define public health ethics, and then we hold that up and compare it to bioethics and to medical ethics, just to help map out how these are similar and how they're different. In module 3, we look at the factors that influence decision-making that we looked at just a moment ago, and look at how ethics can be a part of that mix. And this module, we then look at 4 different ways of understanding or mapping public health ethics, just to give some perspective on different ways that if you say public health ethics to someone, they may be imagining one thing and you may be imagining another. And so we try to cover some of the different terrain around that. Some people just have research ethics in mind. Some have research ethics review boards in mind. So we look at some of the different ways in which people could or would understand public health ethics, just to help you to navigate with other people. Next slide, please. Thanks, Kristen. In module 4, we consider the role of values and principles and how they fit in. And we go over 25 or so values and principles that are most commonly appealed to in public health ethics. Give short definitions and some examples of how they get put to use. In module 5, we look at ethics frameworks. We think they're particularly important for doing applied ethics in public health because they're very practical, they're very usable, and they're also quite commonly used. There are quite a few in the literature. It's in the dozens now. Among the resources we've got on our website, we've got a list of, must be 25 or 30 frameworks for public health ethics. One other thing we do in this module is we give some, we actually present a little taxonomy of the different kinds of characteristics that you will find in a framework. And they differ along several lines. And this with an eye towards giving some guidance for people in order to choose a framework that will work for your particular purposes, because they're very different and some of them are intended for one use and they may not be so good for another use, or some may not work so well with the group you're working with, or they may take too long to use, and so on. So those different characteristics, being able to sort of identify or better understand what a framework might be able to do for you can help you to choose one that'll work for a particular purpose. And in the last module, practice with case studies, that's really the main one. And it's in that module that we put all of this into practice through working on case studies. There are two different parts to it. In the first part, someone will use a framework and apply it to a case study and then try to come up with ways of resolving the issue. And then there are a couple of cases at the end that are much, much more difficult to deal with. And they actually point to broader issues that may not be so easily resolved in an hour or two. So they point towards social conditions and structural issues. But it's important to have that perspective as well. Next slide, please. It says my internet connection is unstable. Is my voice coming through okay? Maybe somebody could just type in if it's hard to hear or if it's not working out. All good? Okay, thanks, Catherine. And in an effort to make this work interesting, it bears saying that the course isn't just all reading. We've put in several exercises that'll test the concepts that have been presented, test people to relate the concepts that have been presented to a few questions or ways of interacting with the work. And as I said, there are also videos, and the perspectives that are offered in those videos I think are really interesting and really important. So that gives a very quick overview of the course. Obviously we'd welcome any questions about that, and I've also put my email at the end, and I would invite you to send me a note if you have any questions about the course material or anything else relating to our work. Feel free to send an email though, and feel free to use the questions in the chat afterwards. But I'll pass the microphone on now to the first of our two guests. Again, I really want to thank both Laurel Burton and Haley Morton for joining us. I'm super interested to hear what both of you have to say today. Both of them have taken the course, and they're going to speak to their experience in doing that and how it went. And also Laurel is going to speak to some of the issues that arise for her in her professional practice. So we'll start with Laurel. She's a healthy settings advisor in population and preventive health at Northern Health in Prince George. Thanks so much, Laurel, for taking the time today, and it's all yours.
Hi there. Thanks so much, Michael. Yeah, so my name is Laurel Burton, and as was said, I'm a Healthy Settings Advisor, and I work for Northern Health, which is one of the regional health authorities in BC. For those of you that aren't familiar, it's structured a little bit differently than it is in Ontario, and we have a group of health authorities in different regions of the province. So yeah, I am a Healthy Settings Advisor, so I work for the Healthy Communities team. I'm a registered dietitian by training and worked for several years as a population health dietitian, and my role within the health authority was the lead for food security. And so I feel like within the context of thinking about public health ethics, I might focus a little bit more on that side of it, mostly because I'm quite new to the Healthy Settings job, and since then I've been fully redeployed to COVID case and contact management. So I'll really speak, I think, to the food security work that I've done, because again, as a healthy community development specialist, of course, that really sort of aligns with that work as well. Anyway, I'll only take a couple minutes, but just again, in general with the course, one thing, I think health is ethics, as I'm sure most of you on the call know. The biggest ethical dilemma is that health inherently is political. And I think that's sort of this constant tension between what is actually impacting people's health and what we have political will in our society to sort of support. And so again, this course it does focus on public health ethics. And of course, with my role as a population health specialist, I sort of took what we did in the course and rather than it being sort of these individual public health, like the example that was given at the beginning, which speaks to sort of broader structural issues, sort of the focus that I have is kind of that population lens and that population health level. So again, the course it nicely goes through kind of the what, why, and the how of public health ethics. Again, just sort of, I think what the course does well is it provides sort of guidance, but reminding everyone that, we have this guidance, we have these tools to help you sort of think through your work, but ultimately, the decisions and the values and what you bring to the work kind of is yours as you move through. As Michael sort of mentioned, there are these case studies, which I think provide really good opportunity to kind of offer a bit of that practical experience on sort of what's being talked about with these things, because you can talk about frameworks and methods and until you're sort of sitting with some of these issues, that's sort of when it really comes to life and makes a lot of sense. So again, I'll sort of, I guess, speak to some ethical tensions in the work that I do, and again, food security is sort of a really big one in terms of, again, with that structural impact of things and sort of where we sit in our communities and as a country and our willingness to sort of address. And so, the biggest example is, how do we adequately support sustainable, culturally safe, long-term investments in access to food for all, when we are sort of still in this place of, the food charity model kind of being what we think about. And so, acknowledging how to build those upstream approaches to something like food security, when we understand that some of those sustainable solutions are more political things like basic income or food sovereignty, or, thinking about, until we're acknowledging and addressing and dismantling systemic racism, food security is not going to be achievable. And so focusing on sort of the level of charity work sort of gives that good sort of example of those tensions, which again, I think the course really sort of encourages us all to think through of, at the end of the day, public and population health, to be person-centered, they really have to be committed to social justice, they have to be ethical, and they have to be equitable. And I think that's really what this course asks you to think about is, and there's a really, really good video in there, a medical health officer talking about sort of the overdose crisis that's in BC. Again, for those who aren't in BC, it's a dual public health crisis, COVID and the overdose crisis right now. And she really speaks to that idea of, I sit in two worlds as a medical health officer, and then, what I do in community. And I think that's what this course does, is it really allows us to sort of put into sort of words that idea that health is extremely complex, and public health is deeply complex, and literally every health issue has those deep complexities, has all of those ethical considerations. So this toolkit that they've offered with this course isn't just something that helps you through a problem here or there. It shapes fundamentally your thinking about how you want to build health, because again, as I'm sure a lot of people on this call are aware, there's this public health tension between behavioral intervention and structural intervention, and until we sort of get to the place where we're addressing structural interventions, you know, how are we really supporting, you know, quote unquote behavior and community? And so again, just sort of bringing it back to that's really what I got from this course is, you know, every time you're doing a public health thing, you know, insert public health issue here, to be thinking about all of the complexities. This course really gives you that sort of step-by-step way of framing these issues in the work that you do. So yeah, I'll stop there. Thanks so much. But again, yeah, I think if anyone has any questions in the chat or whatever, I'll sort of be sticking around for the last bit of this. But thanks so much, everyone.
Thanks, Laurel. That's really interesting to hear from you. So great thoughts there, and much appreciated. Let us move on to hear from Haley Morton. Haley's a project officer with the Canadian Public Health Association, and I will turn it over to you, Haley.
Thanks, Michael. So hi, everyone. My name is Haley, and my pronouns are she and her. And before I begin, I'd like to acknowledge that I'm joining you today from Niagara, which is the traditional territory of the Haudenosaunee and Anishinaabe peoples. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. And I'd like to thank the National Collaborating Center for Healthy Public Policy for having me today and for putting together this wonderful course. So with my time, I'm going to speak a little bit about my experience working through the Introduction to Public Health Ethics course as it relates to my experience as a new public health professional and recent graduate. So currently I'm working at the Canadian Public Health Association as a project officer for the Substance Use Project. But in 2017, I graduated with my BSc in Biomedical Science from the University of Guelph. And in 2019, I completed my MSc in Global Health at McMaster University. So throughout my studies, I never had the opportunity to take any ethics courses, specifically public health ethics. And what limited exposure I did have to ethical dilemmas and frameworks in my classes, it was always within the context of medical ethics. But this course really helped me to understand the key distinctions between medical and public health ethics and the importance of acknowledging public health ethics as its own field due to the distinct challenges that arise when making decisions at the population level. This course outlines several focal points for the study of public health ethics in Canada, including health surveillance, health protection, emergency preparedness and response, health promotion, population health assessment, as well as global health, ecological health, and reconciliation. And seeing the ethical issues unique to global health situated within the broader context of public health alongside other activities essential to public health practice has provided me with a better understanding of how what I learned in my studies fits into the broader public health landscape. And it's helped me to identify certain areas of public health and public health ethics where I might need to pursue more knowledge in order to improve my competencies as a public health professional, as someone who hasn't studied public health as her main field. So throughout my education, I'd been exposed to many of the most pressing issues in global health policy, but the knowledge regarding how to address these complex problems in a professional context was rather lacking. Without the use of ethical frameworks and other tools, it can be easy to oversimplify issues and assume that you'll make the right decision because of your good intentions or the values that you're bringing. But working through the case studies in the course, there were times I thought I'd considered the problem from every angle, but the considerations provided in the feedback compiled by the NCCHPP team always presented me with an additional perspective, which I really appreciated. And I think that one of the primary lessons I'm taking away from this course is to always use the tools at your disposal to inform the decisions you make throughout your work, especially since the decisions made in public health often have widespread implications. And I think as a recent graduate, there can be this tendency to maybe shy away from more controversial issues that don't explicitly fall within the scope of your work in order to avoid maybe ruffling any feathers. But as outlined in this course, two of the key perspectives on public health ethics are advocacy ethics, which defines a commitment to reducing health inequities as a core value underlying public health, and critical public health ethics, which asks us to consider underlying power structures and question how problems are framed. And while major ethical issues and domains that are explicitly within the field of public health are important, the most pressing example of which I can think of being the prioritization of different populations for vaccine distribution, as well as the case study that Michael brought up at the beginning of this webinar. Advancing healthy public policy, such as minimum wage increases and income support, is just as important. And advocating for higher minimum wages or affordable housing might not be immediately associated with public health, but these policies significantly impact the health of populations. So as public health professionals, they inherently fall within the jurisdiction of our work. And this course has done a great job of articulating the privilege and responsibility that public health professionals have to advocate and work towards societal change, which is one of the primary reasons I love this field and the work that I do. And overall, the course is very engaging and suitable for all learning styles as it uses a blend of instructional methods, as Michael mentioned, such as diagrams, written content, and short videos of public health professionals speaking about their experiences, which I found particularly valuable. And it also provides opportunities to test your knowledge through quizzes and example problems with the culmination of the course in several case studies. And it's also very well researched and provides many resources that you can reference, even with an extensive list of frameworks for public health, which I will definitely be referencing moving forward in my public health career. So overall, I would recommend this course to any public health professional looking to expand their competency, but particularly to any recent graduate or student looking to enhance their understanding of the field, especially someone like me who hasn't had a direct career path to public health and is looking to situate themselves and their knowledge within the field. Thanks.
Thanks so much, Haley. That was super interesting to hear. And as I said, I haven't heard too much feedback to this point about the way in which people are taking up the course and what's proving useful or interesting in it. So it's great to hear different takes on that. Thank you. At this point, I want to, before we open it up to questions, I want to do one little exercise with you. And this is one to do at your own discretion, of course, but I'm curious to just see from folks in the chat box, speaking to what are some of the ethical issues that you encounter in practice that require your attention. So take a minute, give some thought to what sort of ethical issues you encounter, and maybe we can just get something going in the chat about that, just for just for a look at what people have in mind. Could relate to conflict of interest. It could relate to moral distress, not being able to do what one takes to be the right thing to do for various reasons. Could be that some important value is being overlooked in a program or policy. It could be that there's a conflict between two different values, as we saw in the Just give you another minute to write here, and we'll have a look at some of the issues that have been raised. reporting of infectious disease of personal care homes and group homes. And yeah, with reporting issues, there's an obligation to report in order to protect people in the group home. And there's also an obligation to respect confidentiality and privacy. There are also organizational parameters that can make things problematic. Maybe there's pressure. Not having a healthy food policy within a regional health authority. I don't know if this is an ethical issue in public health, but why aren't some public health nurses involved? Carolyn, maybe you could add a little more. In this presentation. There's actually a community health nurse will be presenting tomorrow in the French version of this webinar. It's just luck of the draw in this case. There will be a public health nurse speaking to these issues tomorrow, though. And I've noticed that in the lists of people who've signed up for the course, there were a great many people from the health sector, particularly in Quebec, and a lot of nurses. So I was pleased to see that. Supportive housing access systems at the community level. Representation from residents, yeah. I didn't really get into the discussion of what values and principles are presented and discussed in the course, but among them, one of them is community participation as being very, very important. And so something that can and should be brought to bear on decision making is, how is this informed? How were the values identified as being important? How is the community involved? Because it's the community that is affected, and certain subgroups in the community, perhaps in particular, who should really be at the table, helping to define what's important and then develop responses. So yes, representation. Deciding on frameworks to prioritize where to allocate resources. Yeah, always a big, difficult topic, resource allocation. Sadly, not that many frameworks. So if people know of good frameworks for helping with that, I would love to hear about them. But it's super complicated and very important. That public health research should benefit most vulnerable, but doing research with the most vulnerable is higher risk. So it can be challenging for boards and researchers to balance. Yeah. And one thing that is interesting that they've done at Public Health Ontario, and also I think there's a framework in Alberta around this, they've kind of dissolved the boundary a bit between research and practice. And we see that happening in the literature as well, I think, that, okay, if it's research, then there's ethical oversight and you have to submit it to a research ethics board. If it's practice, you kind of just do it. So the way in which Ontario responded, and if somebody in the group is familiar with using this tool, but Public Health Ontario developed tools around doing an assessment of any, I think they said, knowledge generating project, so that you can get a sort of risk level for how much it could impose upon people. And it's not necessarily for research and it's not necessarily for practice, but it could include surveillance or other types of initiative. So it's actually, it's geared towards informing the work rather than being a bar that has to be overcome or surpassed. So interesting work there from Public Health Ontario. And there's an ARECCI tool. I don't know how to say this, but it's an acronym, ARECCI tool in Alberta, which does a similar type of task. Spending money near the end of a budget cycle with no evidence that the item's effectiveness. Yeah. Either stewardship would be a value that would speak to this one, or effectiveness. No evidence that the item's purchase would be effective. Making sure that you're using resources to do the most good possible. And also respecting your role as someone who is given an important public mandate and resources to do good. So being a good steward of those resources and actually respecting the public for whom you're working. Creating public health programming that targets behavior change when we know the issue is more structural and systemic. And this speaks to some of the perhaps professional boundaries and obstacles that someone might face in terms of wanting to address social determinants, for example. Intersection between public health ethics and clinical ethics. Yeah, and I think the case with which I started my part of the talk sort of speaks to that. It's in both. In a triage protocol like that, both public health and population level considerations meet the sort of one-on-one clinical level decision making. And some authors have spoken of this pandemic situation as being one that actually forces us to operate in these two worlds at the same time. As I proceed through some of these comments from people, please also start thinking about any questions you might have that you'd like to raise during our last 5-6 minutes. And we'll try to address them as they come up. But again, feel free to send them by email as well, and I will get back to you. A few more comments here.
Questions, Mike, if you...
Shoot, Kristen, yeah, go ahead. Go ahead.
Okay, great.
Yep.
So, and I think you have spoken to some of them in some way, shape or form. But one of the things maybe that you could expand on a little bit is you were talking about community participation and stewardship as some of those kind of values and principles that are throughout all of the modules. Are there any others that you'd like to mention or highlight here?
As in values?
Yeah, and the values and principles that are, I guess, the foundation for the modules.
Yeah, like I said, there are quite a few that we ended up selecting, and there's a bit of overlap between them. I'd say that following the literature, public health has two main aims. One is to maximize health, and another is to reduce inequalities. Those are the main ones. Now, there are a number of things that we can and should have in mind when we're doing our work. Pandemic, for example, it tends to raise the topic of reciprocity. We saw that in SARS. When the SARS crisis emerged in Toronto, people had to stay home, people missed out on work, and we're seeing it again now. People are being advised to stay home. Health workers are putting themselves at risk, and other people are putting themselves at risk. So there's a back and forth relation there, in that it's important to respect the sacrifices that people are making for the common good, and we express this respect for those sacrifices by honoring them, i.e. through compensation for people who have to stay home and are perhaps made vulnerable because of that. They don't have money to pay rent, or some way of letting essential workers, healthcare workers, others know that society has their back. So reciprocity is one of these many values that we talk about in the course. And in this present situation, it's really clearly important. I think of values as the sort of normative currency of ethics. That's one way of putting it. It's that this is important. And if we're talking about normative ethics, then this value, say reciprocity, let's say equity, let's say making sure that groups participate in informing and in deciding what to do, we're saying that those should matter to others as well. So it's a public, it's a public value, and it's one that in an ethical context, we're talking about that as being something that it's worded in a way to say Kristen, reciprocity is important, and you should respect reciprocity when you are doing your work. And it means that obliges you to hold it up and to consider it and to look at the ways in which that may factor into your actions. So that's how they sort of engage with practice. Others are respecting confidentiality. That's especially important in research and in surveillance work, for example. And then things like not harming people. Respecting the well-being of others means you don't harm them. And that's one that goes back in medical ethics as well, of course, right? Non-maleficence. So there are several like that, and I won't go on too long about that with an eye on the clock.
Yeah, thank you, Michael. I think that that's really insightful, and I think there's plenty more that we can all learn about in taking the course. So I think another question that's come up, and this might actually kind of also fit in a little bit to the discussion we've had between kind of clinical ethics and public health ethics. But given public health's broad application and its policy work, has there been any thought in terms of the intersection with organizational ethics?
It's not an area that I have paid particular attention to. I'll start off by saying that. If I understand correctly, I mean organizational ethics. If I understand correctly what the question or comment is getting at, it's about the ways in which we come up against the boundaries of our of what we're allowed to do. Is that the idea? My job tells me that I'm supposed to do this and not this, but I think what I should do is this. I'm not sure if I understand it correctly, but if that's what the question is, that is entirely a matter of someone navigating their professional space. And obviously we have to keep an eye on what the boundaries are, and we also have to keep an eye on what's important to us. And it's really navigating the boundaries, acceptability, advocacy. One of the videos in the course, Ross Upshur speaks to that a little bit. We asked him to speak about advocacy, and he talked about one way of approaching that. But again, maybe I'm speaking to the wrong question.
I think that makes sense, and I think the comment here from Melody too is about organizational ethics relying on procedural justice principles. So I think you spoke a little bit to that in terms of how to start thinking about navigating that space. So I'm just keeping an eye on the time, and it does look like we are at time. There are several more questions, I think, that people would like to get some feedback on. So I don't know if, as Michael just mentioned, I think he's happy to respond to your questions. If you want to send him an email, his email is on the slide here. With that, I think if that's okay, Michael, we should maybe move on to do a very quick wrap up.
Sure. Maybe just open it up in case Laurel or Haley would like to say anything else, not to put them on the spot to do so, but just to make it a possibility. If either of you would like to say anything to what you've heard, and also to thank them especially. But yeah, go ahead, Kristen. Or sorry, Laurel, Haley, if you'd like to say anything else, now's your shot.
Yeah, no, not really, but thanks everybody. And I think, yeah, these are important conversations to be happening. And I think the more we sort of address and acknowledge the complexities in public health, I think that will only sort of improve the system. Because yeah, I think it's human to have the tendency to sort of try and keep things as simple as possible. So just an important course and important conversations to have to continue to challenge sort of the status quo when it comes to public health.
Yeah, nothing to add on my end, but again, thank you so much for having me today. And I definitely encourage everyone to take the course, especially if you're interested in working through these ethical issues. It presents a lot of opportunities to do so. Thanks.
Yes, yeah, thank you, Laurel, Haley, and a very big thank you too to Michael for leading us through that. This slide up here does show some of the resources as well as the link where you can go to register for the course. I think just one more slide. We do have an evaluation survey that we will be sending out. So if you could please take some time, it really helps us to kind of improve our webinar series and get everyone's thoughts on how it went and some of maybe the reflections that you've had since the end of the webinar. Yeah, please complete the evaluation. And with that, I think just, yes, an all around very big thank you to all of our presenters today and to everybody helping to support making sure that this webinar was able to happen, and as well as to the participants. So thank you everybody for joining us today.